Your dog might look perfectly healthy today, but what if I told you there could be deadly worms growing inside their heart and lungs without you even knowing? Heartworm disease is called a silent killer for a reason. Miss the signs, and it could cost your dog's life. But don't worry, today I'll reveal exactly how to spot it early, how to treat it, and most importantly, how to make sure your furry best friend never suffers from this deadly parasite. Stay with me, because this information could save your dog's life. What happens to dogs with heartworm disease? Symptoms and impact. Heartworm disease is one of the most dangerous conditions your dog can face because it works silently, attacking your pet's heart, lungs, and bloodstream. Let's dive deep into what exactly happens when your dog gets heartworm and how it affects their health. Heartworm disease, caused by a parasitic worm called Durofilaria immitis, begins when a mosquito carrying heartworm larvae bites a dog. Once inside the body, these larvae travel through the bloodstream, eventually settling in the heart, lungs, and nearby blood vessels. Over several months, these larvae mature into long, spaghetti-like worms that can grow up to 12 inches long. This infestation puts tremendous strain on your dog's cardiovascular system, and the damage builds over time. In the early stages, your dog might appear completely healthy. This is why heartworm disease is so dangerous. By the time symptoms appear, the disease is often advanced. One of the earliest warning signs is a persistent cough, especially after exercise. Your dog may also show unusual fatigue. Even simple activities like walking or climbing stairs may become difficult for them. As the worms grow and multiply, the disease progresses to more severe symptoms. You might notice labored breathing because the worms are obstructing blood flow in the lungs, making it harder for oxygen to circulate. Dogs may also experience weight loss, loss of appetite, and swollen abdomen due to fluid buildup caused by heart failure. In severe cases, a condition called caval syndrome occurs, where large numbers of worms clog the heart's main blood vessels, leading to collapse and death if not treated immediately. This disease isn't just a minor inconvenience, it's a life-threatening condition. Even with treatment, the recovery process can take months, and the heart and lungs may never fully return to normal. That's why it's critical for dog owners to recognize these signs early. Another devastating aspect of heartworm disease is the emotional toll on owners. Many pet parents don't realize their dog is infected until they start seeing severe symptoms like weakness, fainting, or coughing up blood. At that point, emergency veterinary care becomes essential, and treatment is often expensive and complex. But here's the good news. With awareness and preventative care, this disease can be stopped before it ever takes hold. The rest of this video will guide you step by step through prevention, diagnosis, and treatment so you can protect your furry friend. Why heartworm disease happens and how it spreads. To protect your dog from heartworm disease, it's essential to understand exactly how this deadly parasite works, where it comes from, and why it's so common in dogs. Let's break it down step by step. Heartworm disease is caused by a parasitic worm called Durofilaria immitis, and its entire life cycle depends on mosquitoes. Mosquitoes are not just a nuisance. They are the only way heartworms spread. When a mosquito bites an infected dog or wild animal like a fox, coyote, or wolf, it sucks in microscopic baby worms called microfilariae. These tiny larvae live in the mosquito for about 10 to 14 days, maturing into an infectious stage. When this infected mosquito bites another dog, it injects the larvae under the dog's skin. From there, these larvae slowly travel through the bloodstream over a period of months. Eventually, they reach the heart, lungs, and surrounding blood vessels, where they grow into adult worms that can live up to 7 years inside your pet's body. A single dog can host dozens, even hundreds of worms. The risk of heartworm disease is not limited to warm climates. While southern states like Florida, Texas, and Louisiana have some of the highest infection rates, heartworms have been diagnosed in all 50 states. This is because mosquitoes can thrive in many environments, and infected dogs can move or travel, carrying the disease with them. Even indoor dogs are at risk because mosquitoes can easily get inside homes. Another reason this disease spreads so rapidly is that dogs often don't show symptoms for months. During that time, they can act as a reservoir for the parasite, meaning any mosquito that bites them can pick up microfilariae and spread them to other dogs. This cycle is what makes heartworm prevention so critical. Heartworm disease is not contagious dog to dog. Your dog cannot catch heartworm by playing with another dog, sharing food or water, or being near an infected pet. It only spreads through mosquitoes. However, because mosquitoes are everywhere and breed quickly, any unprotected dog is vulnerable. Another important factor is climate change. Warmer winters mean mosquitoes are surviving longer and spreading to new regions, which has caused heartworm cases to rise in places where they were previously rare. More mosquitoes mean more opportunities for heartworms to spread. To make things worse, the heartworm parasite has developed ways to evade your dog's immune system. Unlike some parasites that trigger a strong immune response, heartworms are able to grow and reproduce inside your dog's body without being detected for a long time. This stealth factor is what makes them so dangerous. They can cause months of hidden damage before symptoms become obvious. For dog owners, understanding this cycle is a game changer. Prevention is far easier, cheaper, and safer than treatment. In later sections of this video, we'll talk about the best prevention strategies and how veterinarians diagnose heartworm before it becomes deadly. By now, you can see why heartworm is called a silent killer. It's not just about one mosquito bite, it's about a long chain of infection that can only be broken through consistent preventive care. How to care for a dog with heartworm disease. Caring for a dog with heartworm disease is a delicate process that requires patience, dedication, and strict veterinary guidance. This isn't like treating a mild infection or a simple health issue. Heartworm treatment can be tough on your dog's body, and your role as a pet parent is critical to their survival and recovery. When your dog is diagnosed with heartworm disease, your first instinct may be fear or guilt, but don't blame yourself. Even the most responsible dog owners can miss the early signs because heartworms are silent attackers. The most important thing now is to follow your veterinarian's instructions step by step. The first stage of care often involves stabilizing your dog's health before starting treatment. Dogs with advanced heartworm disease may have complications such as heart failure, lung damage, or liver and kidney strain. Your vet may prescribe medications like corticosteroids to reduce inflammation in the lungs, antibiotics like doxycycline to kill bacteria associated with heartworms, and sometimes heart medications to help your dog's heart function better before treatment begins. During this time, your job is to create a calm, stress-free environment. Heartworm-positive dogs should have severely restricted activity levels. Even something as simple as running around the house or jumping off furniture can cause worms to shift or break apart in the bloodstream, leading to dangerous blood clots. For this reason, strict crate rest or confinement is often recommended. It may feel cruel to limit their playtime, but this rest period is critical to survival. Once your vet confirms your dog is ready for treatment, they will typically begin a treatment plan involving merlosamine injections, a medication that kills adult heartworms. These injections are given deep into your dog's back muscles over a series of appointments. This treatment can be painful, so your vet may prescribe pain relief medication. During this process, your dog will still need complete rest, as the dying worms can cause inflammation and blockages in the lungs if your dog becomes too active. Caring for your dog at home during this time requires emotional strength. Many pet parents feel anxious because their dog may seem tired, sore, or unwell. This is normal, as their body is processing the dead worms and inflammation.
Always keep in close contact with your veterinarian and report any signs of labored breathing, sudden collapse, or excessive coughing immediately, as these may be medical emergencies. Another critical aspect of care is managing your dog's nutrition. Dogs fighting heartworm disease benefit from a high-quality, balanced diet rich in protein, omega-3 fatty acids, and antioxidants to support heart and lung health. Supplements like fish oil may also be recommended by your vet. Clean, fresh water should always be available, and you should avoid giving any treats or foods that are high in sodium, as they can worsen fluid retention in heart disease patients. You'll also need to prepare for a long recovery. Even after the last treatment injection, your dog's activity level will need to remain limited for weeks or months. This is because their body will still be breaking down and absorbing the dead worms. X-rays or ultrasounds may be done after treatment to confirm your dog's heart and lungs are healing. While caring for a heartworm-positive dog is challenging, it can also deepen your bond with your pet. The time and effort you put into nursing them back to health will be worth it when they finally recover and get back to enjoying life again. The key is to follow veterinary guidance carefully, stay patient, and never cut corners on rest and medication. Remember, treatment is not just about getting rid of the worms. It's about giving your dog a chance at a full, healthy life.
How to treat heartworm disease effectively. Heartworm disease isn't a simple condition you can fix with a quick pill or a single injection. Treating it is a slow, carefully planned process that requires months of preparation, strict supervision, and follow-ups. But with the right approach, dogs can fully recover and return to a normal, happy life. Treating heartworm disease starts with accurate diagnosis. Veterinarians typically use a heartworm antigen blood test, which detects proteins from adult female worms in the dog's bloodstream. In some cases, microfilariae tests, X-rays, or ultrasounds are performed to determine the severity of the infection and how much damage has already been done to the dog's heart and lungs. Once the infection is confirmed, treatment planning begins immediately. Step 1. Stabilization before treatment. If your dog is severely ill or has a heavy worm burden, treatment cannot start right away. Your vet will focus on stabilizing your dog first. This can include antibiotics like doxycycline. These kill a bacteria called Wolbachia, which lives inside heartworms and contributes to inflammation when the worms die. Steroids, used to reduce swelling in the lungs and blood vessels. Heart medications, for dogs with heart failure or irregular heartbeats. Restricted activity. This step is crucial from day one. Even mild activity can increase the risk of blood clots caused by dying worms. This stabilization phase usually lasts 30 to 60 days, depending on your dog's overall health. Step 2. Adulticide therapy. Melasarmine injections. Once your dog is stable, your vet will begin adulticide therapy using a medication called melasarmine dihydrochloride. This is injected deep into the lumbar muscles in the dog's back and is the only approved medication that kills adult heartworms. The 3-dose protocol is the most common. First injection, given on day 1. Second and third injections, given 1 month later, 24 hours apart. This approach allows your dog's body to slowly kill and absorb worms, reducing the risk of dangerous reactions. During this phase, dogs often need pain management medication because the injections can be uncomfortable. Step 3. Killing the microfilariae. Once adult worms are eliminated, your vet will prescribe medications to kill microfilariae, or baby heartworms, still circulating in the bloodstream. Typically, ivermectin or other preventative drugs are used. This step ensures the infection is completely cleared and prevents new worms from maturing. Step 4. Strict rest and monitoring. After treatment begins, the risk to your dog actually increases temporarily. When adult worms die, their remains travel through the bloodstream to the lungs, where they are broken down by the immune system. This process can cause severe pulmonary embolism, or blockage in the lungs, which is why strict exercise restriction is vital.
For several months, your dog should only go outside for bathroom breaks and should be kept calm at all times. Step 5. Post-treatment testing. 6 months after completing treatment, your vet will retest your dog for heartworm antigens to confirm the infection is gone. X-rays or ultrasounds may also be repeated to evaluate heart and lung recovery. Some damage may remain permanently, especially if the infection was advanced, but early detection and proper care greatly reduce the risk of long-term complications. Treatment costs and challenges. Heartworm treatment can cost anywhere from $500 to over $1,500, depending on your dog's size, health condition, and region. While it may sound expensive, the cost of skipping treatment is far higher: severe illness, lifelong organ damage, or even death. Prevention is always cheaper and easier than treatment. Emotional and behavioral support. During treatment, your dog may experience fatigue, soreness, or anxiety from limited activity. This is emotionally hard for both dogs and owners. To help your dog, create a calm and cozy recovery space with soft bedding. Use puzzle feeders or toys to provide mental stimulation without physical exertion. And spend extra time bonding through gentle petting, grooming, or calm indoor training. This emotional support is just as important as medication because it reduces stress, which helps your dog heal faster. Success stories and hope. Thousands of dogs every year are successfully treated for heartworm disease, even in advanced cases. The key is early detection and following your vet's plan. Dogs that receive proper care often live full, healthy lives post-treatment. With patience, dedication, and professional veterinary guidance, recovery is absolutely possible.
How to prevent heartworm disease and keep your dog safe forever. The most powerful tool against heartworm disease isn't expensive treatment or emergency care, it's prevention. The truth is, heartworm disease is entirely preventable with consistent care and simple habits. Let's explore how you can protect your furry best friend from this deadly parasite for life. Heartworm prevention is a lifelong commitment. Since mosquitoes are the only way heartworms spread, and mosquitoes exist in every climate, your dog is always at risk. Even if you live in a city, keep your dog indoors, or rarely travel, mosquitoes can easily enter homes. That's why prevention is non-negotiable for all dogs, regardless of their environment. Step 1. Year-round preventative medications. There are several forms of heartworm prevention medications. Monthly oral tablets or chewables, like HeartGuard or Sentinel. Topical solutions applied to the skin, like Revolution. Long-acting injections given by your veterinarian every 6 to 12 months, like ProHeart. These medications don't just kill baby heartworms, larvae, but they often provide added protection against other parasites like fleas, ticks, and intestinal worms. The key is consistency. Missing even 1 or 2 doses can leave your dog vulnerable because a single mosquito bite is enough to start an infection. Many vets recommend year-round prevention even in colder regions because climate change has extended mosquito seasons, and skipping doses increases the risk of gaps in protection. Step 2. Annual heartworm testing. Even if your dog is on preventative medication, annual testing is critical. No preventative is 100% effective, and dogs can occasionally miss doses or spit out their medication without their owners noticing. A yearly heartworm antigen test ensures that your dog is still heartworm-free. This simple blood test is quick, affordable, and often bundled into your dog's annual wellness exam. Catching an infection early dramatically improves the chance of full recovery. Step 3. Mosquito control around your home. While medications are the primary defense, reducing mosquito exposure is an added layer of safety. You can remove standing water in flower pots, gutters, and yards where mosquitoes breed, install window and door screens to keep mosquitoes out of your home, use pet-safe mosquito repellents in high-risk areas, avoid evening walks in mosquito-heavy regions when they're most active,
Step 4. Protecting puppies and rescue dogs. Puppies can be started on heartworm prevention as early as 6 to 8 weeks of age. For rescue dogs or dogs with an unknown history, testing should always be done before starting prevention. Giving preventative medication to a heartworm-positive dog can be dangerous if not supervised by a veterinarian. Step 5. Educate yourself and others. One of the biggest reasons heartworm disease remains common is a lack of awareness. Many pet owners assume heartworms are rare or only affect outdoor dogs, but this isn't true. By learning about heartworm prevention and sharing your knowledge with friends and fellow dog lovers, you can help reduce infections in your community. Step 6. Travel awareness. If you travel with your dog, be aware of the heartworm risks in different states or countries. Some regions have higher infection rates, and even short trips to mosquito-heavy areas can put your dog at risk. Always keep preventative medication up to date, and if you're traveling internationally, ask your vet for extra precautions. The importance of a preventative routine. The truth is that heartworm disease is much harder and more expensive to treat than it is to prevent. Treatment can take months, involve multiple vet visits, and cost over $1,000, whereas monthly preventatives cost a fraction of that. More importantly, prevention saves your dog from suffering. Creating a prevention routine is simple. 1. Set monthly reminders on your phone or calendar to give your dog their medication. 2. Schedule annual vet visits for testing and checkups. 3. Make mosquito control part of your household routine. A future without heartworm. Imagine a world where heartworm disease becomes rare or even eradicated. That's possible if every pet owner takes prevention seriously. Your dog relies on you for protection, and with just a little consistency, you can ensure they never suffer from this deadly parasite. Your dog doesn't know the danger heartworms pose, but they trust you to keep them safe. Prevention is an act of love, one of the most important gifts you can give your furry companion.